Teresa Shinneman was my first wife. She calls me, she says, "Dave, do you remember the lump on my neck?" And that's when she said, "I have cancer." It was breast cancer that had metastasized into her neck. It was a fairly aggressive form. We lost her, unfortunately.
I started a Silver Lining Foundation in 2002 because of a need, and that need was access to mammography for women and men who were uninsured or underinsured.
We're a non-for-profit organization. We serve a lot of the uninsured. We do have about 30 to 40% of our patients are uninsured. We learned about Silver Lining Foundation when our funds for a different program that we used to get free mammograms with lost some of their funding. When we called them, we had a great experience with them. They were very friendly. We had a lot of patients that called in and were able to get their free mammograms.
A Silver Lining Foundation has 4 programs, but at the heart of what we do is Buy a Mama Mammogram, which funds the entire spectrum of breast health services from screenings through biopsy at 9 partner hospitals. What we do is to remove those barriers, cultural and financial, and everyone who comes through our program is treated with the dignity and respect that each human being deserves.
Breast cancer is the #2 killer of women. One of the main needs that the Silver Lining Foundation fills for women is the access to breast health care. And the reason is that we might be able to talk about it, we might be able to do whatever we can in the clinic setting, but without the actual mammograms or ultrasounds or biopsy services or even further surgical services, there's no way for the women to then receive any further care that they may need.
Now the need continues to grow. Last year, we served over 1,200 women with 1,400 procedures. This year, we are on track to double that number. What we want to do at a Silver Lining Foundation, and for this we need your help, is to basically level the playing field where access to a potentially life-saving test is concerned. What we do is ease lives and save lives. I ask you to join us in our mission. Each and every one of us knows someone that has been stricken by breast cancer, or we have ourselves.
Knowing what I know now, seeing what I've seen, three years of 8 surgeries, 4 rounds of chemotherapy, 2-3 rounds of radiation. For people to have access to avoid this, to avoid leaving an 8-year-old son motherless. This is why we're here.